Come on in.
Hi there, my name's Brianne. I'm a nurse here at St. Joe's Clinic. How are you today?
Good. How are you?
Good. Let me just start off by making sure I have the right person. Can you tell me your name and your date of birth?
Kevin Jones, 10/30/76.
Okay, great. Is it okay if I call you Kevin?
Sure. It's my name.
All right. So I understand that you're new to the area, Kevin, and you're looking to establish some primary care here?
Yeah. Just moved here a couple weeks ago.
Okay. Where'd you move from?
Texas.
Wow. Texas to Minnesota. That's going to be a weather
Yes.
change for you.
Picked the wrong time to move.
All right. Well, welcome to St. Joe's. We're definitely happy that you chose our facility. I'm just going to spend some time getting to know you. I've got a bunch of questions to ask. Basically, health assessment questions. Do you have any questions before we get started?
No.
Okay. So, who do you live with?
My 3 children.
Okay. How old are your children?
12, 10, and 4.
How are they adjusting with this move?
Oh, they're not. A couple of them are happy. The oldest is not happy. She was into basketball. She's got to transition to new teams. But the other ones, they're excited about the snow. Not much snow in Texas.
Yeah. I'll just be writing a few things down. All right. Well, I'm glad to hear things are going pretty good. That's not easy to do a move across the country like that. Do you have any health concerns that you want to tell me about?
No.
Okay. So I'll just get right in. Have you ever had surgery?
Nope. I should have, but I didn't. You see, a couple injuries from basketball.
Just a basketball finger. It looks like you jammed your finger.
Yep. Daughter calls it crooked finger now.
Any issues with appetite or diet?
Nope, not really. I don't eat a whole lot.
Okay.
Picky eater.
You're a picky eater.
Yeah.
So you feel like you eat 3 meals a day?
No.
You don't eat 3 meals a day.
No.
How many meals a day do you eat?
2. Yep. 2.
Okay. Do you eat fruits and vegetables daily?
Not every day.
How often would you say you eat fruits or vegetables?
A couple days a week.
Okay, 1 serving a couple days a week?
Well, yeah. I have oranges more often. I have an orange almost every day. Probably.
Okay, so you do have a
Something.
fruit. Okay. What kind of food are you eating? Are you cooking at home or?
Not really. Eat out a lot.
Okay.
A lot of pizza.
Everyone loves pizza. How much water do you drink? Do you drink 8 ounces or 8 glasses a day?
Probably not 8. Maybe half of that.
Okay. Exercise. How often do you exercise?
3 days a week.
And what kind of exercise?
Basketball in the morning.
Okay. And how long are you playing basketball for?
Couple hours.
Okay, so it looks like your skin is surviving the Minnesota cold here. Do you have any skin issues that you are concerned about?
Nope.
Okay, no moles, rashes, or anything like that? Your nails aren't like peeling or cracking? Your hair looks like it's healthy?
Yep.
Okay. How about headaches? Do you ever get headaches?
Occasionally. Yeah.
So once a week?
Probably less than maybe once a month.
Oh, okay. And what do you think is the trigger for that?
Like lack of sleep or contacts are bothering me.
Oh, okay. Are you sleeping okay?
Yeah, I just stay up a lot, so it's by choice.
Okay. So I see you wearing glasses. When's the last time you were at the eye doctor?
Probably a year ago.
And other than needing a prescription, no issues were found.
No.
Any issues with your hearing?
No, it works good when I want it to.
Selective hearing?
Yep.
I'm writing down works good. Okay. How about your nose, your sense of smell, or allergies? Any colds recently?
Nope.
Okay.
No allergies. Haven't had a cold in a while.
Okay. And your sense of smell is okay?
Yep.
Okay. That's an important one now with COVID.
Yeah.
How about your throat? Any issues swallowing or pain?
No.
Okay. When's the last time you went to the dentist?
Maybe a while ago. A few years ago.
Okay. Any issues with your teeth that you're concerned about?
Mm-mm.
Any history of heart problems?
For myself? No.
Does anyone in your family have heart problems? Mom,
Maybe
dad?
an uncle.
An uncle?
Yeah.
What kind of heart problems?
I don't know. Not sure. Thought he died of a heart attack. But
A heart attack?
it could have been.
Not quite sure though.
Not quite.
Okay.
Could have been COVID.
Do you ever have a hard time breathing?
No, not really.
Okay.
Get out of breath from playing basketball, but that's
After vigorous activity, okay. Anyone in your family have we already kind of went there. I was going about the heart problems. Do you have bowel movements regularly?
Yes.
Once a day?
Probably twice a day. Huh?
Twice a day?
Yeah.
And it's not like diarrhea or constipation or anything like that. Any issues going or urinating?
No.
Okay,
No.
good. Any concerns with your genital area?
Mm-mm.
Okay. How about circulation? Do you have any issues there? Maybe varicose veins in your legs, or do your fingers and toes get really cold?
I get really cold.
You get really cold. Can you?
I'm not used to this weather.
Oh.
So other than that,
But if you wore gloves, your circulation would be okay?
I never had a problem before I moved here.
Okay.
It's just very cold.
Okay. Any pain or stiffness when moving anything? Any back problems or joint problems or muscle bone?
I pulled a muscle in my neck area playing basketball before. I was sore for a couple days.
Do you have that currently?
No.
When did that happen?
A couple months ago.
And it's healed?
Yeah.
Okay. Did you need to go see anybody for that, or did it heal on its own?
Just healed on its own.
Okay. Do you have a history of any blood disorders?
Nope.
Sickle cell, diabetes?
Mm-mm.
Okay. Any history of anxiety or depression?
Not that I know.
Okay. Do you
Like in my family or?
No, you.
No, me, no.
Okay.
Not me.
Do you feel like you have a pretty good pulse on that?
Mhm.
Okay. Any recreational drug use?
A little bit.
Okay. What kind of drugs?
Just marijuana.
Okay. And how often do you smoke marijuana?
I'd say on the weekends. So,
On the weekends?
yeah.
Okay. And do you do that around your children?
No.
Okay.
It's a late night thing.
With friends? Okay.
Yeah.
Okay. Okay. Do you drink alcohol?
Very rarely.
Is that once a week, once a month?
Once a month.
Once a month.
Yeah.
How many drinks?
Probably 2 or 3.
Okay. Are you sexually active?
Not at the moment.
Okay. Any concerns with your sexuality or sex drive or anything like that?
No. No concerns.
Okay. Tell me about your mom. Is she alive?
Yes.
Does she have any health concerns?
I think she might have like stomach issues or something. I don't know what it is exactly.
With going to the bathroom, with eating.
Yeah, I think when she eats certain things, her stomach acts up, but I don't know what it's called. I just know that's the only time I hear her not feeling well.
Okay.
It has something to do with her stomach.
And she eats certain things.
Yeah.
Okay. What about her parents? Did they have any health concerns?
Not sure at all.
Okay. And your dad, does he have any health concerns? Is he still living?
Yeah, he's still living.
Okay.
He drinks a lot, but I don't know, like, if he's... I'm sure the doctors have probably told him he shouldn't drink, but he does.
So you think maybe a little bit of a substance abuse?
Mm-hmm.
Okay. And what about his parents?
Again, don't know.
Okay. Do you have siblings?
I got one brother.
One brother.
Yep.
And does he have any health concerns?
Nope. I think he's doing good.
Okay. He's not overweight or...
No.
And your parents are not overweight
No.
either? Okay, well, let's look over what we got here. So, recently moved here from Texas. You've got 3 children, 12, 10, and 4. Your oldest is a basketball player.
Yep.
All right. Well, we've got good basketball here too, so hopefully she'll get used to it. No surgeries. Are you concerned about the eating? Are you wanting to eat more?
No.
How much do you weigh?
I weigh like 205.
205. And how tall are you?
5'11".
Okay. And you're getting a fruit in daily. Maybe we can start getting a vegetable or 2 in there.
Oh yeah. Okay.
Okay.
We'll try.
Yeah. And then water. It sounds like you're getting 4 glasses of water a day. A recommended dose would be 8, but 4 is pretty good. And then the exercising 3 days a week basketball. That's great. So good to see that. No skin concerns. There's no moles or anything you're concerned about. Headaches occasionally once a month from lack of sleep, but no sleeping issues you do have glasses, and you see your eye doctor regularly?
Yeah, I have to go enough to get my contacts removed.
Okay, so you do contacts too. Hearing, no issues there. No issues with allergies or throat. You go to the dentist regularly. Oh no, you don't go to the
Yeah,
dentist.
that's what I gotta work on.
Okay.
Okay.
All right, you know that. That's fine. And then you don't have any heart problems, but you had an uncle that died of a heart attack.
Mm-hmm.
Okay. And no issues breathing, regular bowel movements, no issues going to having to urinate, no issues with your genital area. Circulation's okay other than getting used to the cold weather here. No blood disorders, no anxiety or depression. You are using marijuana on the weekends. I'm sure you know that's illegal, but you know, you're grown and can make your own decisions. Alcohol once a month, 2 to 3 drinks. And you're not sexually active at this time. Is that just because you don't have a spouse?
Yeah.
Okay. And it looks like the only thing in your family history that you're aware of is the stomach issues with your mom.
Mm-hmm.
Okay. Anything else that you can think of that these questions brought up for you today?
No, not really.
Okay. Well, you seem to be really healthy. We're glad that you're here and we can provide you some care, and hopefully you'll be around for a while.
Hope so.
No moving anywhere else soon?
Nope, I don't think so.
Okay.
We're here to stay.
All right. Did your work bring you here? Or?
Yeah, got a promotion.
Good for you.
Mm-hmm.
Nice. Well, I'm going to go get the doctor, and I thank you for being open with me today.
Thank you.
Yeah, nice to meet you.
Nice to meet you too. Come in.
Hi, I'm back. There's a couple other questions I just wanted to ask you. Are you taking any medications right now?
Just ibuprofen for the headaches.
Oh, okay. And how much of the ibuprofen do you take?
Just a couple.
So 2?
2 at a time.
Okay. And do you know how many milligrams, or
They're the small ones.
the small ones? Okay. So 2 of those. When you have your headaches, is that like once a day that it gets rid of it, or do you?
Yeah, occasionally like 4 hours. Maybe I have to take 2 more, but not that often.
Okay.
2 usually does the trick.
Okay. Any vitamins or supplements?
No.
Okay. And no prescriptions?
Nope, no prescriptions.
Okay. I appreciate your time.
Mm-hmm.
And I think that does end everything now.
Okay,
Thank you.
thanks.